Hello, warm welcome to all of you children. How are you all? Hope you are all doing very fine. Okay, so we are learning something about excretory system, a very important system that filters out many waste material. Major waste material is thrown out of our body through excretory system. Okay, but then in today's session we are going to see what happens when we are not being careful about our food intake. Okay, so there are some disorders that we are going to see that may happen in the kidneys if you are not careful. First thing is going to be uh, kidney stone. I think we have already seen urinary tract infection, and also one more that was, I think, yeah, that was it. We have just seen urinary tract infection before this, right? No, and that is happening because of the E. coli that is present in the digestive system, but somehow it comes to from the anus to the towards this site where we urinate. Okay, from there it makes an entry and then causes an infection. Yes, and let us now move forward to see what is this kidney stone. Have a look at this. Now these are just examples, and they come in various shapes actually. I mean, when they are formed, obviously they start from being very minute and then slowly they grow in size. Okay, the stones, okay, it is just like a stone structure. uh, but then what makes these stones happen in the kidney? So these are hard minerals that are formed inside the kidney during filtration of the blood. Okay, in the kidney they are formed during the process of filtration. Okay, you can see the picture here. Yeah, so you can see that stone bin moving towards the ureters now. So that this is what they are telling us, that they occur when the intake is heavy with with mineral waste such as calcium oxalate and calcium phosphate in the blood. So there are these two minerals. See, there are so many kinds of minerals. One of it is calcium. So calcium oxalate and calcium phosphate is one of the byproduct of calcium. Okay, it is formed in the process. Various metabolic processes keep happening. So when this calcium, there are two forms of this calcium being told here: calcium oxalate and calcium phosphate. They are too much in amount. They are major in amount. Okay, when they are so much, like they ultimately are required. Calcium is good for bones basically, but then if it is more and the kidney is not able to filter that, it starts kind of being accumulating over in there inside the kidneys, because that is just not, it is too heavy for the kidneys to filter. Yeah, so it starts accumulating over there and finally it will turn into a bone like a hard structure which the kidney won't be able to filter at all. The minerals are formed in the kidneys and are passed towards the ureter. So once the nephrons are unable to, they are unable to filter and a stone like deposition keeps on happening, then they are passed towards the next part, that is the ureters. These small stones can pass through the ureters easily without pain. So if in case the size is small, they are going to pass through the ureters very easily. But bigger stones block ureters and obstruct the path of urine, causing severe pain in the abdomen. In such conditions, doctors have to operate to remove the stones. So there is no other solution. If it is, the stones are going to be very big in size, obviously the ureters will, it's not that compatible that they are going to just simply keep pushing it. No, small size can easily pass, and after the medication they just go out through your urine. But in case they are too major or too big in size, then doctors have to operate. But then today, in today's generation, like at least we know there are many other Ayurvedic and other methods that are usually adopted by the patients. They don't have to go to this painful process of being operated. Actually, there are other medicines apart from the allopathy. There are homeopathies, or say Ayurvedic medicines, that help the stones to dissolve in the kidney itself. Yes. Then let us see what are the main causes of and symptoms of kidney stones. Insufficient water intake along with a diet rich in calcium causes kidney stones. Okay, so insufficient water is the one factor, and plus if you are going to have a lot of calcium rich food, everything that is all having calcium, like the milk and the milk products mainly, because that is having the calcium, most of the calcium. and also you're not having sufficient water to drain them out, to flush them out. So kidney is going to be facing a lot of problem, flushing them out, and somehow they will start getting deposited there. So once you have the kidney stone, what are the symptoms? So you're going to have a lot of pain on the sides of the back, in the lower back, okay, and during urination especially. Persistent need to urinate. You feel like going to, there's, you have to urinate, but there's, even if the bladder is not full, you feel like that you need to go to urinate. And then there's foul smell and cloudy urine. So the smell is really dirty, not the normal ones, but it becomes more foul, okay. And the cloudy urine is, that means it there's a different texture if you're having those kidney stones. It becomes more muddy or say cloudy, okay, than the normal ones which what you normally observe. Previously also I told you that depending on the color of the urine, the doctors are able to identify, we are able to have a kind of a preliminary symptom that some infection or some disease is existing in the person, because there is a difference between the normal urine in color and when a person is infected with some or the other disease or infection. Okay, now this is what it is. Yeah, next is precautions. What can we do? Obviously, sufficient drinking of water, at least 8 to 10 glasses of water. It all depends on your age and height also, everything. But then you have to see that at least minimum 8 to 10 glasses of water intake should be there. Limit the intake of salt, oxalate rich food, and animal protein. Yeah, these are the things that add up to the calcium product thing in the body. So we are not going to have lot of salts, oxalate, which is having lot of calcium, or animal protein. We should prevent it. So now there is one link I am giving here in this PPT also, and in the video link also. This is a beautiful video that shows the animation about how a kidney stone is formed inside the kidneys. Okay, so do have a look at it. The next part is the last part of the lesson, so I'm not in a hurry to finish it up. The last part we are going to discuss about kidney failure. This is a very important part. A lot of people in country or majorly in the world suffer through this kidney failure. So what is the solution that we have for that? But what causes it, and then what can be done if it happens? Okay, and nobody should go through such kind of painful procedures, but then so that is the reason we need to be careful. We just have we are very much interested in our outward looks, right? But then we also need to see that internal organs internally are healthy or no. So next lecture we will cover that, and that will be the end of the portion as well, so not in a hurry at all. Then we are going to have a very nice revision session, don't worry. But till that time, you please go through the content of whatever is being taught to you. Start completing the notes from, obviously section 1 is all objective. Start writing section 2, go one by one. Every lecture I'm not going to keep telling that, okay, now complete this or this. You have to keep gradually writing the notes from section 2, F, G, H, I, J. Yeah, till I you can write, okay, and then J, when it comes to J, you please have to write in your own language, in your own points. You can shorten the points. If it is describe the internal structure of kidney, make it short. The ones like I have made it in the PPT. You have to make your own notes. Do not just copy paste from the textbook or from the PDF of the notes. You have to make. I am very much okay, or I will be happy in fact to see your answers coming in mind maps or the flow chart as well. Okay, so that is what it is. Please complete the notes of this lesson slowly, and then we will have nice revision sessions, quizzes, and everything else. Let me try out what can be done on the teams and how it can be done. Okay, children, so have a very nice time ahead. Go to the video, and a happy learning process to you. Have a very healthy, hygienic day ahead. Bye bye, take care.